Tonight's discussion C talks about long-lasting, life-changing effects of near-death experiences. So we're going to discuss that for C tonight. So please join me for tonight's presentation C. Here we go. Near-death experiences can have lasting, life-changing effects. And New University of Virginia School of Medicine research sheds light on the types of counseling and support that can best help people cope. Okay. The research from UVA's Division of Perceptual Studies is believed to be the first to explore the most common and effective ways to assist people grappling with potentially profound changes to their worldview. For most near-death experiences or NDEs have a positive effect. The brush with death can give experiencers renewed purpose of life, a desire to serve others, and an hold on a second. Give me a second, guys. Okay. Take 2. Near-death experiences can have lasting, life-changing effects. And New University of Virginia School of Medicine research sheds light on the types of counseling and support that can best help people cope. The research from UVA's Division of Perceptual Studies is believed to be the first to explore the most common and effective ways to assist people grappling with potentially profound changes to their worldview. For most near-death experiences or NDEs have a positive effect. The brush with death can give experiencers renewed purpose in life, a desire to serve others, and an appreciation for being part of a greater whole. But even then, some people may struggle to make sense of the experience, especially if their NDE conflicts with their religious or external beliefs, personal values, or scientific views. Additionally, individuals who have had an NDE may struggle with incorporating changes in priorities, relationships, and values into their lives. In dealing with the aftermath of a near-death experience, people can benefit from the right type of support, says researcher Marietta Penhilova, PhD of UVA's Health Department of Psychiatry and Neurobehavioral Sciences. We know a lot about these experiences from decades of research, including their typical manifestations, incidents, medical circumstances, their impacts on individuals, and even the psychological conditions of patients who have them, she said. However, the research on how to support these patients and their specific needs is still limited. We hope to begin addressing this gap, and to inspire other researchers, especially clinicians, to devote time and care in pursuing these questions. Effects of near-death experiences. Penhilova and her colleagues looked at the types of professional help, therapy, and other forms of support sought by 167 people after their near-death experience, and the factors that predict who will need support after the experience. The researchers also asked the experiencers how helpful they found the different forms of support. More than half of the experiencers, 64%, had reached out for help, and 78% of those found the support helpful. The greater the intensity of the NDE, the more likely the experiencers were to seek help. The researchers found people with a history of psychological difficulties were also significantly more likely to seek support. One key to successful support was acceptance and validation. Many people hesitate to seek help for fear they will be labeled crazy. The researchers note Strikingly, people who received a positive or accepting first reaction when they disclosed their experiences were much more likely to describe the overall support they received as beneficial. People were more likely to describe the support as helpful if they were older, if they described their childhoods as happy, hinting at greater resilience, and if they received support from groups or online sources that are friendly and knowledgeable about phenomenon of near-death experiences. The researchers report in a new scientific paper outlining their findings. Future people people who describe their mental health as good were less likely to report seeking support after their NDE, more likely to report that support was helpful if they sought it. This may be because they have greater mental health resiliency, allowing them to process the NDE without the need for external support, or their current mental health may have been the result of receiving validating support. The researchers say, notably, supports received from mental health professionals was associated with lower perceived helpfulness. This may reflect a need for more counselors, therapists, and health professionals specifically trained to help people cope with near-death experiences. And the researchers concluded, we are hoping that this work brings light to the support needs of individuals who have a near-death experience and are trying to make sense of it and its impact. Pentalova said, in a new era of holistic patient care and extensive research on these experiences, including in medical journals, it's important to highlight the need for education on health care providers to address the gap of care for these patients. Okay, guys, so that is it for the evening. I may jump back on later for something else, for another show or so. Until then, Gator Wellness, take care, folks.